B.Yisrael, and of course, Secretary of Health, Wellness, and Social Development. And this whole question of dengue, so very, very serious indeed. And let's welcome Dr. B.Yisrael. Good morning and welcome.
Hi, good morning, Brother B. Good morning, Cox.
Very
Pleasure
good.
being
Morning.
here.
All right, let's get an overview as to the situation with dengue in Tobago. We heard of one case. Where are we with this dengue outbreak?
Certainly. So that is where we are. For this season, we only have one confirmed case of dengue. And when we say confirmed case, we mean a case where we sent a sample to the Trinidad Public Health Lab, and they sent us back the results indicating that yes, this person does in fact have dengue. So let me explain the process. So at the beginning of the period where we recognize there may be an increase in a particular illness, the Office of the County Medical Officer of Health usually sends out a notice to the TRHA saying, this is a disease that we want you to start, looking into. This is a disease that is popping up. So look out for these symptoms. If you see these symptoms, because this is what a case is, definitely take this sample so that we can send it to the lab, and then we can do the follow-up after. And that is exactly what happened in this situation, where the TRHA identified someone who they thought had the symptoms, and we followed the protocol, and we recognized over the weekend that yes, this person is in fact dengue positive, for want
All
of a
right.
better term.
So, what are the symptoms should one exhibit, and what to look for with this disease?
Certainly. So, dengue is you get dengue if you get a virus, right? So it's a viral infection. Like most other viral infections, the symptoms are pretty similar. You get the headache, you get the body ache, you get nausea, a little bit of vomiting, you see a rash sometimes. But I think the symptom that causes us to go in the direction of dengue is pain behind the eye. If you've known anyone with dengue, they would tell you there was that pain that they were feeling behind the eye. It's a headache, but it's an eye ache, and it's just a strange feeling. So that is one of the symptoms that we look for, and that is a particular symptom that helps us to narrow it down a little bit to say, well, yeah, we're talking about dengue versus any of the other viral infections. But those are the common symptoms. There are more severe symptoms though, and let me remind us that previously we talk about dengue fever because, of course, fever is one of the things that happens when you get it. But in the past, you've heard us talking about dengue hemorrhagic fever, hemorrhagic meaning relating to blood, bleeding. So some of the more severe symptoms that you may experience include belly pain, um, tenderness, vomiting at least 3 times within a day, bleeding from the nose or from the mouth, from the gums. If you notice that there's blood in your stool or blood in your vomit, it's because you have actually started bleeding. And all of these extreme severe symptoms can actually cause your body to go into shock. It could cause your organs to start failing, and that can actually lead to death.
Okay, so we heard from the Minister of Health speaking to some figures, and of course, he more or less was saying that there's a sharp rise in terms of the cases, and naturally that would be in Trinidad based on what you're saying here with the one case in Tobago. But he also went on to speak about the fact that spraying, chemical spraying is insufficient, and persons need to do or report issues where persons are basically breeding mosquitoes, whether you know it or not. What is the situation in Tobago in terms of persons or places where mosquitoes would be breeding? What is the approach from the division?
Certainly, well, our public health department has actually been very proactive when it comes to that. Uh, if you would recognize, continually you are seeing our perifocal workers, you are seeing our public health people coming and knocking on your doors, asking to look around your home just to make sure you don't have any receptacles that can actually breed dengue. And that is why it is even though spraying is an option, and even though we spray, for example, after we find a case, so the single case that we have now, the single confirmed case, the public health department would then go to that person's home, spray that person's home, spray the homes that are close to that person, and so forth. But for everyone else, we are really encouraging you to go back to the things we've always been talking about. Mosquitoes breed where there is water, where there's water in containers, for example. So if you have a water receptacle, if you have something, the situation with Wassa, people are storing water. If you have to store water for use in your home, ensure that the water container is actually covered so that the mosquitoes can't get in, they can't breed, they can't lay eggs, and then have more mosquitoes being multiplied around your home. Again, look around your household. Do you have old tires? Do you have old paint cans that are storing water? Do you have plant containers that you put plants in that you water, and then at the bottom the saucer that we catch the excess water? Make sure that that isn't storing water and that is actually cleaned out. Those are the kinds of things we are really encouraging people to do, because those are the things that prevent the Aedes mosquitoes and all of the other kinds of mosquitoes, to be frankly, from breeding and multiplying. And that is what is going to prevent us from getting dengue or any of the other mosquito-borne diseases.
I know that normally, I remember in primary school time where you may see mosquitoes. You will use your hand and try to remove the mosquito from in your presence. But in terms of the transmission, just to be clear, in terms of a mosquito that is already carrying the dengue and transmitting it to an individual, just give us just a clearer perspective in terms of what exactly is occurring there, so persons can be even more aware of the danger of mosquitoes being in your presence.
Certainly. Now, the thing about mosquitoes is that when it bites you, it releases into the person it's biting, but it also sucks up from the person or the thing that it is biting. And that is where, so the mosquito is really a carrier. The virus is wherever it is. Somebody gets bitten by a mosquito. That mosquito picks up that virus, flies over to somebody else, bites them, and deposits the virus into that new person. That is how it is transmitted, basically. That is why one of the things we have actually said to the Tobago public is try to prevent yourself from getting bitten by mosquitoes. So the prevention is really twofold. If you have things that can breed mosquitoes, try your best to keep your surroundings clean, keep those water receptacles covered, and throw out what needs to be thrown out so that you're not breeding mosquitoes. But for the mosquitoes that are already around, already flying around, you have to try your best to not have those mosquitoes bite you. And what does that mean? It means using mosquito repellents, and there are the ones that you could buy in the store with the DEET, but they are the ones that have, the natural ones, the citronella, the lavender, the peppermint, and those things. So those are mosquito repellents. So you're putting it on your skin, and that the smell of it or the chemicals in it is preventing the mosquitoes from coming close to you. Or you need to wear, long sleeved, long pants, clothes that covers your skin. Or you need to going back to the sleeping under a net, or sleeping in where places are closed, where the mosquitoes can't get to you. Because as I said before, it is the bite from the mosquito that is transferring the virus from one entity to another. So you have to prevent the mosquitoes from multiplying in one instance, but also prevent yourself from getting bitten in the other instance.
All right, so the Aedes aegypti mosquito, and that also can spread yellow fever, chikungunya, and Zika. Just speak to us about is it specifically the Aedes aegypti, if I'm not pronouncing it right, just forgive me. However, is a particular type of mosquito, or is just any mosquito?
So the main one is the Aedes, but there are several types of Aedes. Aegypti is one of them. There are others that actually transmit this particular kind of virus. But I actually said it on another media house yesterday, that the important thing is to not try to identify the mosquito. Because by the time you walking around trying to identify the mosquito, it doesn't bite you, it go on and bite somebody else, and we're in problems. We need to try to get rid of all of them. all of the mosquitoes that are around. Let us not breed any because we do not know which ones we are
Correct.
actively
Okay.
breeding.
All right.
So the aim is get rid of all of them.
All right. So, is there a difference between chikungunya and Zika, and the correlation with dengue? Just give us a breakdown as to which of these three correlated, if at all.
Right. So what we're talking about is the disease that we get based on the virus that we get infected with. So they are just different, a different virus. It's like COVID was a different virus. Of course, COVID, we were not getting it from mosquitoes. Let me make that clear. But and HIV is a different virus. The virus that causes chikungunya and Zika and so forth, they're all different. So it's just a different pathogen, a different virus that is transmitted via the same mosquito.
Okay, and in terms of, can we consider it an outbreak that we're experiencing here in Trinidad and Tobago? What is the medical term used officially, and how alarming is the situation, Dr. Faith B.Yisrael?
So certainly, so the epidemiological definition of outbreak is more than what you normally have, right? So and that is a very tricky thing because if you normally only have two and suddenly you have 10, that in theory is more than you normally have, which is classified as an outbreak. And what we are seeing this year in Trinidad and Tobago, if we're using the statistics for the country on a whole, yes, we seem to have more than we usually have. So more than we had last year and possibly the year before, more than we usually have. Although when you break it down to Tobago, because we've only had one so far, and I am hoping it stays at one, of course, the way these things happen, like in the release that we sent out over the weekend, that one can, within a couple of days multiply and become 100. That's why this is so critical. Um, for Tobago, when we look at the numbers that we've had thus far compared to previous years, we are not there at the outbreak definition yet. But for our country, I would certainly use that definition, certainly.
Okay, and in terms of when someone, all right, with using the example of this one individual, this person is quarantined for how long, and what is the process when you start to see symptoms and you want to make that report? How does the public health unit treat with these individuals?
Right. So the good thing is that for the vast majority of people who get dengue, they only get, in some instances, no symptoms. So some children in particular are very resilient and they don't get symptoms at all. In some instances, most people get very mild symptoms, and only a few people get to the stage where they have really severe, critical, life-threatening symptoms. So because that is the usual trajectory of how the disease is, in this case, we do not do quarantining, for example, for people with dengue. We just encourage you to, keep yourself, try to prevent yourself from getting bitten because it means you have the virus inside of you. And if a mosquito bites you, it then can transmit to somebody else. We encourage you that if you have those mild symptoms, that you treat yourself. You drink your fever grass tea because it makes you feel better because you have a fever and the fever grass tea works. Or you take some other kind of medication that helps with the symptoms. So you take like a paracetamol, so that is like a Tylenol or a Panadol or something to help with the headache, to help with the fever, to help with those things. We encourage that. What we are also letting people know, and let me be clear about this too, because the disease can lead to bleeding, you need to ensure that you do not take any medication that thins the blood or that can cause unnecessary bleeding. And those things are like ibuprofen and naproxen and aspirin. Aspirin is a blood thinner. So we do not want you to take anything that can cause you to bleed even more if you happen to get to the stage where your disease is pretty severe. And if you have any of those more severe symptoms, like the vomiting and the bleeding and so forth, definitely get yourself to a medical facility, because you may need additional support from a medical professionals to help you overcome dengue.
Not so long ago, we had fogging as option or in combating the mosquito presence in homes. That was banned, if I'm not mistaken. Public health may have banned that. I'm not sure. You would give me the correct what position was taken against that. Besides fogging, what else can people do? Of course, we talk about the sprays that we can buy at the drugstore and in the groceries. What measures, besides knocking on doors and ensuring that your containers are not carrying water and so on, from a public health standpoint, is fogging still an option?
So what was banned wasn't the fogging. What was discontinued was the thing that we were fogging with, which is a malathion is the name of the chemical that we were fogging with. So it's not that fogging was banned, it's just the chemicals that we were using to fog. What we do not do island-wide fogging, or we will not do island-wide spraying at this point, because we are not getting the numbers so far to get us to think that we need to do an island-wide thing. See, if we start seeing 5 cases in Charleville, 5 cases in Speyside, 5 in Delaford, 5 in Roxborough, 5, and we realize it through the whole island, then we know we have to go and spray the whole island, kind of thing. But for now, what we do is really come in and spray around the case that we have identified to ensure that at least that case is not spreading it further. The other thing that we do is some of the public health people, when they come around, if they recognize that you have containers that you are storing water, even if it is water for washing, water for cleaning, water for drinking, there is a little chemical that we can drop into the water that helps it to be safe, as in it causes the mosquitoes to not breed, so it kills the eggs if there were any eggs in the water or anything like that, but it is still safe for human consumption and human use. So that is an option that we have been using. We've been doing that already at this point. So it's really just to continue with the public health side of using that little chemical in water if we see it, going around getting people to remove their things that are not safe, and really bringing the public further into this discussion so that the public can take the responsibility. We don't have enough public health people to go around to every single house and empty out a container. So we're asking you as the individual to just this morning take 5 minutes, walk around your house inside and outside, see if it have anything that kind of hole in water, throw it out, clean it, turn it upside down, throw it away, or whatever it is that you need to do, just to make sure that your home is not a breeding ground at this point.
All right, Dr. Fit, there are those who would say preventative, onset prevention is better than a cure. The measure to wait, basically what you're saying is if there is a real big outbreak, then you respond accordingly to do fogging. To be reactive and to be proactive is two different things. Obviously, I'm not trying to be controversial, but shouldn't we put the measure in place to ensure that there's no outbreak by doing the fogging? Is there a cost factor that may prevent such a move, or what it is preventing us from being proactive than wait until cases are broken out?
And you have hit the nail on the head. Yes, we could be proactive by just coming and spraying out the whole island and knocking it out and spending the money. But if a week after that, everyone still has their containers open and the water thing in and everything else, 2 weeks after we spray out the whole island, we could still have another case because the mosquitoes come back. So it really is we have to think about a wise use of our resources, given our limited resources and given what we hope to accomplish by doing the actions that are available to us.
Okay. Well, I mean, we will continue to monitor. Is it going to be a situation where, just like during the pandemic, the COVID-19 pandemic, releases were issued regularly to give persons an idea in terms of the cases, or you would do it on a, I don't know, what's the plan with regards to rolling out the data?
So it is not absolutely necessary. Again, dengue is something that we have normally. To be honest, the only reason we did the release over the weekend is because it was our first official case, and it was important for us to know and let the public know that we've had our first official case, because that would trigger these kinds of conversations as well, to get people thinking and to get people acting and to get people doing what they need to do. Um, I do not envision that every single time there is a case, we will send out a notice. After a while, you all will not even read the notices that come from my division if we do that. But if we recognize, for example, that we have seen a significant rise, we will notify about that. Certainly, if we recognize that there was a dengue-related death, we would probably want to notify, the public about that. But other than that, it is not something where you will see a notice coming from us every week saying we only have one dengue case or anything like that. That is not how we intend to do this. But it's also based on the surveillance, and that is the critical point, because we actually have a pretty proactive
For the Y-Side
surveillance
Shine
system
Morning
that has
News.
been set up to do this.
Okay.
All right.
Okay.
We got to leave it there. We want to thank you very much, Dr. Faith, and we'll speak again as soon as the information comes in. Thank you, ma'am.
Thank you.
Very good. All right. So we do have morning news at this point in time. Let's take